Well, it was a bit of a surprise because I did not expect it, during a conference dinner at the Belfast Titanic. But I'm definitely deeply honored and humbled to be selected for the 2023 BTOG Lifetime Achievement Award. And thank you to the BTOG Scientific Committee. And this award is definitely not possible without the support of so many collaborators, clinicians, research organizations, including my UCL Trial Center, the London Lung Cancer Group, Cancer Research UK, who funded so many of our NCRL trials over the last 3 decades, several pharma companies who give us free drugs to NHS for the trial, including Lilly, Roche, and obviously, most important, the patients and their family. So throughout my career, over 40 years, I've been very fortunate to witness this massive transformation for lung cancer treatment and how far we have come forward. I treated the first series of non-small cell patients in the 1980s, where we MVP the second generation chemotherapy drugs, median survival, 8 months. So from a starting point where there's little hope and despair to where we are now, where we're seeing long-term survival for stage 4 disease at 5 years. I think in UK we should be very proud because we play a very important role in the journey to get where we are. We conducted so many randomized phase 3 trials over the last 3 decades. It's starting off with the MRC meta-analysis on NSCLC, where it showed chemotherapy can improve benefit. We did a BTOG study where we compared chemotherapy with best supportive care and changed practice in UK and worldwide, confirming chemotherapy improves survival for stage 4 disease. Then we did our study 10, where we did our Gen-Carbo, the first trial ever with any gemcitabine carboplatin regimen. And we showed this 3rd generation chemotherapy is better than 2nd generation. And then we did a first randomized study for poor PS patients. We announced it back 2 decades ago. And we say it's possible. And this leads on to the present Ipsos study, where we now show change practice. Then we did the first biomarker chemotherapy trial, ERCC1. We show platinum doublet should remain a standard of care worldwide to treat lung cancer. Then obviously the Thelema trials we designed 2 decades ago. Crazy idea, but it captivated the world. And we're very proud of it because, it was a big study, a randomized study, and we recruited all these patients in less than 2 years. We still have much to learn and discover in lung cancer. Nowadays, we need to understand DKI drug resistance, immunotherapy drug resistance. We need to understand this complex immune landscape, young patient, old patient. In our Ipsos study, we found PD-L1 not important. We need to understand why. And obviously, we're going to new combination chemotherapy trials nowadays. Then the tumor heterogeneity we need to understand. Then got cancer vaccine story coming along, and we need to tap into that. So in recognizing this Lifetime Achievement Award, there is still a lot of work to be done to fight against lung cancer. We need to be clever. We need to collaborate. We need to be innovative. We need to translate this finding into clinical practice. Importantly, we need young researchers specializing in genomics to take up a career in lung cancer research. This is where genomic driving the next wave of progress in lung cancer. So we need both lab research, clinical trials like we did all these 3 decades to make a difference, change practice, and to bring hope to many affected by lung cancer worldwide. Thank you very much. And thank you to my wife to support me all these years.